So as I mentioned before, we're just going to touch very briefly now on the role of digital health technologies, particularly for us looking at self-management and chronic illness. So you may or may not be familiar with the Australian Digital Health Agency. So federally funded, Commonwealth organisation, which over the last couple of years has really been charged with moving forward in terms of digital health. So, digitally enabled models of care, and a whole range of things which we've kind of touched on. Some things like My Health Record, for example, which is both something that can offer real benefits and also something that poses real challenges in terms of privacy and security and concerns about those things. So Greg Hunt, the Federal Minister for Health, he's quoted as saying that digital health is the penicillin of our time. That's a fairly strong statement, but it is clear that it offers opportunities to address previously incurable diseases and also to deliver better life-saving healthcare. So as I just mentioned, there are a lot of benefits that can be realised, and I think at the same time we need to be aware of and manage risks that come along with technology. But I'm sure many of you have already, worked at facilities like the PA, which are fully online. So you're already kind of working with this space. So terminology can be a pain, but it's really important to cover it and be familiar with it. So we've actually, the nomenclature for this area has changed, or it's evolved, I guess is the best way to put it. And most of you would be familiar with the term e-health, which is an abbreviation of electronic health. So we've got e-health, we've got m-health or mobile health, we've got telehealth. There are a whole range of, and then there's telemedicine. There are a whole range of different terms which kind of describe different features, but they can all be understood to come under the broader banner of digital health. Which, as you can see, that the federal, the Commonwealth organisation is called Digital Health Australia. So that's a fairly good lead to follow in terms of terminology. Although I will acknowledge that health informatics and nursing informatics is another area or another science that you may come across. And it positions itself actually above digital health. So if you come across health informatics, and that's informatics, INFORMATICS. Health informatics, nursing informatics, they are other discrete areas that encompass digital health, e-health, m-health, telehealth. I think for us, for our purposes, it's best to keep it simple in terms of what our understanding of digital health is. And really, if we ask, what is it about? Digital health is really about electronically connecting all the different points of care so that health information can be shared securely. And really, that's the first step in understanding how digital health can help deliver safe, more safe, and better quality healthcare. So ultimately, it's about progress. It's about providing care in a way that's more effective, more innovative, more efficient. It's about progress, really. And if you look, you can look at a whole host of examples of improvements that have been made through technology just in our daily lives. You look at the phone that you're using and what you can do with your phone compared to 10, 20, 30 years ago. At the same time, it's important to be aware of challenges and risks, and to be able to manage those. And as we've been, looking at for assignment 1, part of your task is to critique and recommend a couple of different digital health resources, whether they be a website or a resource on a website or a particular health-related app. But you need to critique that and actually weigh up the benefits and the limitations. So one example of a very topical national example of digital health is the My Health record. I've mentioned that. So you can check out that site at myhealth.gov.au. And yeah, that's a really good example where a lot of concern has been expressed, and at the same time, a lot of positivity has also been expressed about what can be achieved by something like this. So that's one that you can go and look up and explore and discern for yourself in terms of, we each actually have a choice as to whether we want to have a My Health record. And the government has had quite probably a 6-month opt-out period where everyone in Australia can actually say, no, I don't want to have one. And then beyond that opt-out period, a My Health record is actually created for everyone who didn't opt out. But at the same time, you can go and check out that site, and it will explain that you can still choose at any time to say that you don't want to have one, or you can choose what records can be shared on your My Health record, and you can change your mind and say, no, I don't want them shared anymore, even though previously I did. So yeah, and look, this is not the first iteration. My Health record in an earlier carnation was called Personally Controlled Electronic Health Record, or the PCEHR. And it had a lot of challenges in terms of being rolled out, and they've rethought, rebranded, and re-legislated actually. So legislation has been an ongoing issue with My Health record in terms of making sure all the laws are as watertight as they can be to engender confidence in the security and privacy of records for health consumers. So like I said, that's up to each individual. And if you haven't already, you might have patients asking you about that. And so you can kind of share what information you know, or refer them to that website. This is the website that I've just been talking about, My Health Record, the Australian Digital Health Agency, and so it outlines the benefits. It's got a whole list of frequently asked questions. It explains about privacy and security, and they've got the latest kind of statistics as to how many people are using My Health Record at the moment. And I think we've actually got a little clip as an example of just a patient case study or vignette in terms of, how does this actually work? What does it actually do? Why would we bother with something like this? At the end of the day, for a patient, how does it actually help? So let's have a listen to this particular story.
I got a job in the mines and moved from Melbourne to Mackay in central Queensland. So I started playing football for a local football club, and after 6 years, we won the grand final. I had a bit of an off feeling after the game, and I just felt like I wanted to get home. Pulled up in the driveway and called the ambulance, and 2 paramedics arrived about 18 minutes later. I ended up collapsing in my bedroom. They checked my vitals and straight away started CPR.
Oh, that phone call was devastating. Like, what's wrong? So he had a heart attack and has stopped breathing.
I had a rupture in my artery wall. They think it's from severe dehydration, overexertion, obviously the adrenaline pumping through a grand final match. I was defib 8 times, straight into intensive care unit.
So after caring for Nick for 4 weeks after his heart attack, I had to come back home to Victoria from Mackay in Queensland, and I went straight to our family doctor to let him know what had happened.
Previously, there was nothing really dramatic in Nick's health, and then he disappeared for that time while he was away and came back having had a heart attack, which was pretty major given his young age. He did direct me to his my health record.
Well, it helped me having a digital copy of everything instead of having to go to my GP or the cardiologist with a binder full of everything, my blood tests, my discharge summaries.
It included investigational reports and angiograms and whatever else was needed.
So I didn't need to go through that traumatic experience of explaining everything.
Yeah, everything was on the system, and it was very helpful.
My view of young men and their approach to health in general is that it's fairly lacking.
It was a bit of a wake-up call going into cardiac rehab, and knowing that you're the youngest by 20 years, I needed to change, and a healthy lifestyle really became the focus. I would recommend my health record to my mates and family and everybody else that is thinking about using it. There's no excuse not to keep track of your record. So get down to your GP and ask them about my health record.
So that's his story, and in that case, he found it to be very helpful. A lot of people, some people are concerned about privacy, and that's fair enough. And I guess it's up to each individual in terms of your own health history and whether it's a common concern about privacy, and I guess for me, in terms of privacy, I guess I think about the benefits and whether they outweigh the risks. And I guess for each of us, it's up to, it's a personal thing about, is there anything in my health history that, if someone knew, would it actually matter to me? And I think for me, there's nothing remarkable about my health history that I would be upset if someone hacked in it and knew that if I'm taking pantoprazole at the moment, does that really matter? For me, it doesn't. And I see a lot of benefits that can be realised, but that's not necessarily the case for everyone. So, I think again, it's just up to each individual to assess, and those things change, and that's fine, and that's why they've built in that capacity that at one point you can say, yes, happy for everything to be shared, or actually no, happy for everything to be shared except for this. And then I can change my mind tomorrow and change that. And then I can change it again. So, moving on. So, mobile apps are another example of resources that can help support self-management. In this case, here's an example of an app that's developed to support Parkinson's, so to help track symptoms more closely and to share that information between health consumers and clinicians. Another example, MND Australia. So in the last couple of years, they've been developing a mobile app which is being designed to support self-management. So for those who have come to workshops, have been spending time testing out some different apps and critiquing them, or for those who are working through the workbook, you've been doing that remotely, and we'll look forward to seeing in assessment 1 whether it's a website resource, whether it's a mobile app resource that you actually critique and recommend for your poster.